To administer tube feeding for our patient, the first thing we're going to do, as always, check our provider's order. We need to check what food is ordered for our patient, then we need to gather our supplies. So we have our Ensure, we have our graduate, we have our syringe, we have an alcohol swab, and then we also have our bag of tube feed that we are going to pour our Ensure into. So the next thing I'm going to do is perform hand hygiene and then put on gloves and enter the patient's room. I'm going to ask the patient to give me his name and date of birth, as well as any allergies, and I'm going to introduce myself and let him know that I'm going to be hanging some tube feed for him today. Just like our other videos, the first thing we're going to want to do is do our abdominal assessment. So we're going to listen for bowel sounds, starting in the right lower quadrant. Moving clockwise. After we completed that, we can palpate the patient's abdomen, checking for rigidity or any pain. And we're doing good there. Next, we're going to check, just like for medications, we're going to check gastric residual volume. Pulling back, we're noting the amount as well as color of the gastric residual volume. Again, if we have excess, we are going to hold the feed as well as the gastric residual volume and contact the provider. All right, and then after we do that, we are going to return that to the patient. We'll return the gastric residual volume back to the patient, and then we are going to flush with 30 cc's of tepid water after we've returned that to the patient. Take our syringe off. Next, we're going to inspect our Ensure can, making sure it's what's ordered for our patient, making sure it's not expired, and we'll give it a little shake. And then since this is a can, we're going to want to alcohol the top of it. And then we can grab our tube feeding bag, open up the top, and then we're going to pour our whole can of Ensure into the bag. Before we do that, we're going to need to make sure that our clamp is clamped so we don't lose any of our tube feed. And after that's clamped and we poured it in, we will close the bag, hang it up on the pole next to the patient, and then we're going to squeeze our drip chamber, making sure that the Ensure is coming into the chamber, and then we're going to prime our tubing all the way to the end, just like IV tubing. After we have it primed, we're going to hook it up to our patient, and then we're going to work on calculating the drip factor based on the physician's orders, making sure the patient stays in the semi-Fowler's position the whole time and an hour after the tube feed is completed.